Imagine that your entire self is specifically your brain. You have a condition where you are very swollen and unable to function properly because your tissues die constantly. Now imagine undergoing an MRI scan, a traumatic event caused by a rare formality of life. This is all related to a rare and detrimental disease known as necrotizing encephalitis. This disease is found in both humans and animals and is fascinating in every way in the veterinary medicine field. As a veterinary assistant and pet lover myself, I am intrigued with this disease as it is mainly breed specific, but is still one of life's little mysteries. With current technology, MRIs are one of the main diagnostics used to diagnose this disease, and through further research, necrotizing encephalitis is becoming a disease that is well known, which we will discuss today. Necrotizing encephalitis is a rare and unknown disease in veterinary medicine that causes detrimental damage to the important organ known as the brain in breed-specific animals. Necrotizing encephalitis is diagnosed through MRI scans. Necrotizing encephalitis is caused by specific gene mutations in breed-specific breeds of dogs. Necrotizing encephalitis does not have a known cure, but is managed with medications to help relieve symptoms, and treatment trials are being newly renowned. Necrotizing encephalitis once was a hard disease to diagnose, but can now be determined by MRI scans of the patient's brain. Necrotizing encephalitis is a rare veterinary-associated disease diagnosed by breed-specific MRIs. It is obvious that with neurological diseases, MRIs or CTs would be used for diagnosis. According to frontier.org, breed-specific MRIs help identify characteristics of necrotizing meningoencephalitis. Some of these characteristics include lesion distribution, signal intensity, contrast enhancement, and gross changes of the brain structure, including midline shift and brain herniations. The MRIs are noted as breed-specific because this is usually a small breed-specific neurological disease. However, this disease can occur in any breed of dog or cat regardless of their breed, age, sex, or any remarkable characteristics of each patient. Despite the fact that age, sex, or breed is dependent on whether or not an animal is susceptible to this disease, there is a specific gene component which allows this disease to remain dormant, but occur in specific breeds. Necrotizing encephalitis has been researched extensively and has been found that a specific gene or genes are to be the cause of this horrendous disease when mutations are found. Within veterinary research, there is always a question of why diseases or conditions happen or are caused, and now for this disease, there is an answer to this question. According to PubMed, found near the dog leukocyte antigen, DLA, complex on CFA12, the specific gene, using STR markers on CFA12, the exact genes are BRB1, DQA1, and DQB1. It is not known if the genes are always to be damaged or mutated to cause the symptoms of necrotizing encephalitis, but it is known to be one of the main causes of this disease. However, it is still unknown if this disease can lay dormant within these genes and then have later in life that would cause necrotizing encephalitis to become active. Although VetMed has done extensive research on necrotizing encephalitis, there is still the looming question of ever finding a cure, similarly to finding a cure for cancer. Without a cure for such a horrendous disease, symptoms are overwhelming and almost intolerable, but research has proved supportive medications and therapies are used to minimize pain. According to Walking.com, long-term high-dose corticosteroid therapy, high-dose prednisone, and anti-seizure medications can be prescribed. Medications have their own effects on the dog's bodies. For instance, phenobarb, an anti-seizure medication, can cause liver damage if the patient doesn't have enough seizures within a specific time period. The oral steroids can cause excessive weight gain and thirst in the patient. And veterinary research is very important to the knowledge surrounding this disease, and it is known that necrotizing encephalitis has a huge impact on veterinary medicine field. Necrotizing encephalitis is a rare and unknown disease in veterinary medicine that causes detrimental damage to the important organ known as the brain. Necrotizing encephalitis is diagnosed through MRI scans. Necrotizing encephalitis is caused by specific gene mutations in specific dog breeds. Necrotizing encephalitis does not have a known cure, but is managed with medications to help relieve symptoms, and treatment trials are being newly renowned. Even though necrotizing encephalitis is a rare and unknown disease, the veterinary medicine field is preparing itself and research every case and every aspect it comes across. Without this disease, we could never see or believe in life's little mysteries.